I think we can
Another-
begin now.
Recording
I
in
can begin?
progress.
Yes,
Yeah, how
Doctor.
many? How many are we?
240.
Okay, perfect. So, hello everybody. I hope we are all fine. The lecture today is on the timetable. However, I think you do know that the naming was changed with DSM-5. So we are going to talk about intellectual disability. Again, I'm Dr. Rachel Kangethe. Management of intellectual disability. So today we'll just define, understand the causes, look at the epidemiology and clinical presentation, and just a brief outline on treatment and management, since we'll do it in 6th year in details. This is a very, very, very important topic, so be very attentive. Why is it very important to know about intellectual disability? Intellectual disability is a very common disorder with prevalence of 1% in the general population, which is like the prevalence of schizophrenia. In low-income countries like our Kenya, research shows the rates are 2-3 times even more common than the worldwide 1% prevalence. This condition that is lifelong leads to stigmatization and poses heavy burden, and even about 40% of those with intellectual disability also have psychiatric morbidity. This condition is preventable. So if we can focus and listen to the causes, there are some causes that can be prevented, and the person need not suffer from intellectual disability. Once it sets in, it's in, and people suffer because of the burden of the intellectual disability to the child, to the individual who is affected. However, it's one of those illnesses which not only affects the individual, but also affects the family, the community at large as well. For the child, the adverse effects and burden they have from their intellectual disability is by the adverse effects intellectual disability has on the child's development. And all this translates to a lot of burden on the family and high caregiver stress. And the community also has to give some resources and tolerate and so on. So it affects everybody. In addition, there are certain risks that are posed by the intellectual disability on affected people. They can be neglected, they can be abused, they can get some harmful forms of traditional healing. Many of them in the rural areas are tied on a tree and just left the whole day and so on and so forth. But the key thing we need to remember is that at the end of the day, there is effective, okay, number one, it's preventable. Number two, for those who get it, there is effective treatment and education about the disorder is available. So we need to understand so that we can help the lots of Kenyans who are affected by the intellectual disability, either directly or family-wise or community-wise. All right, we'll start with defining some concepts. We start with intelligence. Okay, I love the topic of intelligence. However, this is not a psychology lecture, so we don't have the luxury to explore and debate and think about all the wide concepts about intelligence. Basically, intelligence is ability to adapt to one's environment. It refers to general mental ability, general mental abilities, the ability to learn quickly, to learn efficiently, to learn from experience, the ability to understand complex ideas, to think abstractly when you are an adult, and to solve problems, and so on, so that somebody can cope with their environment. So for now, that will be our definition for intelligence for the purpose of this lecture on intellectual disability. So what is intelligent quotient, IQ? Intellectual functioning is represented by intelligence quotient, scores that are obtained from standardized intelligence tests. Standardized is a very important word here. Most of these IQ tests were not developed for us here in our situation in Africa, in Kenya. They are not culture fair. Maybe you've heard of Carothers, a psychiatrist in Mathare during colonial era. He actually used some of these IQ tests and has written journals saying that adult Africans' intelligence is only equivalent to that of an 8-year-old white boy. But this is because these tests often are not culture fair. And again, there might be language problems by the persons who are administering them. During colonial times, you can imagine how fearful these people were being asked all those questions by Amuzungu, and it's a cube and some things you don't know whether it's a game or a joke and so on. You know, maybe you don't take it seriously. Anyways, when they are standardized, they are useful. when they are used by people who are familiar with the culture, and when they are used for what they were meant to be used for, because they were not used to find out who is cleverer, who is not. Really, these IQ tests were developed to help children who were not doing well in school to find out what sort of help they needed, really, not their intelligence or intelligence in the general community and so on. The IQ tests use the formula that IQ, intelligence quotient, is mental age over chronological age times 100. That is the formula of how you get an IQ. Your chronological age is your true age from the day you were born to now. Mental age is how you are doing things, whether they are at the level of your peers, below or above. So if mental age, MA, is the same as chronological age, then the ratio is 1. If the person is 10 years old and their mental age is 10, then it's 10 over 10 times 100, and IQ 100, because it's 1 times 100. And that's an average IQ. It means the person is doing the same things in the same way as other people of their age. So what they are doing is age appropriate. If the mental age is higher than the chronological age, then of course the IQ will be higher. And if it's even higher, then people become geniuses. On the other hand, if the MA is less than the chronological age, then the IQ is lower than 100, which means mentally one is not doing the things that the same chronological aged people are doing. They are doing things that much younger people are doing. So if the person is 10 years old, they could be doing things that an 8-year-old is doing. Yeah? For your own understanding, try and calculate what our IQ would be as per Carotha's results, which I told you before. You can in-text your answers later. All right. The other definition that we need to understand is adaptive behavior. Adaptive behavior is a good concept, better than IQ concept, in that it's checking how you're adapting to your environment. And that is what intelligence is all about, adapting to your environment. Yeah. I suppose if you're a chokora, it doesn't matter how much you can read in big volumes, but if you can't run very fast and be able to notice when those cops are there, you will not adapt very well in that environment. So adaptive behavior is a more culture-friendly concept. So adaptive functioning is one's ability to cope with day-to-day tasks in a satisfactory manner, because you can never cope 100%, but you can cope good enough. So DSM-5 dimensions of adaptive skills are 3. 1, conceptual skills. These are language literacy, time, number concepts, self-directions, more like academic skills. Then you have this practical skills, which is activities of daily living, personal care, cooking, household chores, taking care of your health, taking a matatu or driving, occupational skills, schedule, safety, use of money and telephone, and these days, of course, cyber and all those media things so that you are not conned and so on. Then there's the social skills, which deals with interpersonal skills, social responsibility, self-esteem, gullibility, social problem solving, and ability to follow rules and to avoid being victimized or being taken advantage of, being exploited. So different cultures actually emphasize different aspects of this in their concept of intelligence. But that's a lecture for another day. For now, let's focus on what is intellectual disability. As I noted at the beginning, intellectual disability previously was referred to as mental retardation. And of course, you do remember the previous names like idiot, imbecile, and so on. So all those have been discarded because of stigma and because of them being used like in an abusive manner. So don't use them. So don't call people morons or idiots or mentally retarded. A diagnosis of intellectual ability is given when a person has problems in intellectual functioning and they have problems in their ability to function in everyday activities. These people who have intellectual disability, depending on their age or severity of the intellectual disability, can have problems with speaking, reading, eating, using phone, taking care of themselves. And these are activities of daily living, things that you need to master in order to adapt to your environment. Intellectual disability is a neurodevelopmental disorder. The thing about developmental disorders is that the symptoms are not constant. The symptoms will change as the people are changing, because what you are really looking at is developmentally inappropriate skills. So if you are 6 months old and you are not speaking, nobody will worry about you are not speaking. But if you are 5 years old and you are still not speaking because of what milestones are expected to have been achieved at 5 years, then that would be an issue. So that's why I cannot come and tell you the symptoms of intellectual disability is not walking, not being able to read, because those symptoms have to be gauged against the expected developmental skills at that stage. So as we'll see later, the symptoms will vary depending on what is expected at that particular developmental stage. Intellectual disability specifically is defined as limited mental abilities or arrested or incomplete development of mental abilities. And these limited mental abilities or arrested or incomplete or even deteriorated, you can lose them. It has to occur during the developmental period. So even a child who was born with normal intelligence, if they get a road traffic accident and they get brain damage, if it is during the developmental period, you'll not talk about dementia. You'll still talk about intellectual disability. However, if it's over 18 years, again, you will not talk about intellectual disability now. You'll talk about dementia or cognitive deficits, cognitive impairment, and so on. So this intellectual functioning for now is measured by standardized IQ tests. However, because of scarcity or because these tests are not culturally fair, sometimes in our setting, it's all right to use clinical judgment, to use the parents' impression. However, when possible, the standardized test should be administered. These standardized tests, again, before 5 years old, may not give very accurate results. And at that stage, you might talk of developmental delay rather than intellectual disability. In addition to the limited intellectual functioning, to the sub-average intellectual functioning, there must be adaptive functioning deficits in the 3 domains that we mentioned, in the conceptual, social, and the practical. And now we are more into a social definition of intellectual disability, which really is talking about one adapting to their environment. So it's not enough just to think of the person. You also have to think of the environment that they are having to adapt to. So it doesn't really matter about the IQ per se in the individual. The environment as well can increase or decrease the severity of the intellectual disability depending on the external environmental factors and the level of support which the individual can receive. Okay, so these days, like say, people who are physically handicapped, there are all these motorized cars and motorized wheelchairs, and there are ways that they can just put their wheelchair in their car, remove it, go to the shop, and can even be faster than people who are walking slowly. So in that situation, disabled because they are able to adapt and survive and even thrive in their environment. So these days, you don't just think of the problem in the person, you also think of the environment, what it demands, and the level of support that is being given to the individual. If from just a place where all you have to look after cattle, you don't have to cross busy roads and get on the media and so on. the demands in that environment might not be too much as in another environment. So that's what we mean by the fact that the degree, the severity can be increased or decreased by external environmental factors and the level of support given to the person with the intellectual disability. Epidemiology, we already looked at that. Worldwide, we said is 1%. However, in lower income countries, due to environmental factors, the environment such as poverty, malnutrition, poor medical services, the severity and rate of intellectual disability is much greater, and the burden on the family because of the level of support is also much, much more. Males are more likely than females to be diagnosed with intellectual disability. For mild disabilities, the sex ratio male to female is 1.6 to 1, while in severe, the ratio is 1.2 to 1. And again, this is because of some sex-linked gene mutations and the biological inequality, which makes the male much more vulnerable. DSM-5 criteria. However, it does not put greater emphasis on IQ like the DSM-4 used to. It puts more emphasis, correctly, in my opinion, on the adaptive functioning skills. And those, as we said, are more culture fair, they are relating to your environment, so it's a good story. So this neurodevelopmental disorder, as per the DSM diagnostic criteria, has 3 core criteria. 1, the intellectual deficits, reasoning, problem solving, abstract thinking, judgment, academic learning, learning from experience, that must be confirmed by both clinical assessment and individualized, standardized intelligence tests. Secondly, deficits in adaptive function that result in failure to meet developmental and sociocultural standards for personal independence and social responsibility. And we are talking about conceptual skills such as communication, language, money, management, or intelligence and academic, but also social skills, interpersonal skills, social responsibility, recreation and friendships, and so on, as well as practical skills, daily activities of living, work, and travel. And the third criteria is that the intellectual problems, as well as the adaptive problems, must have had an onset during the developmental period before 18 years of age. The severity classification has also been expanded in the DSM-5. In DSM-4, it relied mainly just on the IQ. Now it's been expanded to include the levels of impairment, difficulties with adaptive functioning, but also taking into consideration support available in 5 domains: in the intellectual aptitudes, adaptation level, participation, health, and social context, which includes the environment, culture, and and opportunity dimension. So it's been broadened. It no longer just emphasizes IQ. It does include the IQ, but more emphasis on activities of daily living and adaptive skills, and also assesses the environment the individual is in those 5 domains. The severity is still as we knew it. There is mild intellectual disability, and will have the IQ of 55 to 70. However, if somebody has an IQ of 60, but their adaptive functioning is at 80, their intellectual disability will be rated at 80, not by the IQ. But again, it can increase or reduce depending on the support that is available. So the mild category constitutes most of those with intellectual disability. Some figures says it ranges 80 to 90, some say 85%, some say 75%. So we can say from 75% to like 90 will be people with mild intellectual disability. And the causes in this group mainly is environmental risk factors, usually preventable ones. And these people physically will look like everybody else without any physical abnormalities. They can be educated, and they may live independently with community and social support. So where the environment is intellectual disability friendly, they will survive and even thrive. The second is moderate intellectual disability with IQs of 40 to 54%. This group, they are trainable. They can learn to work and take care of themselves. They do acquire some communication, and in communities with good support, they may live and function successfully. Then we have the severe intellectual disability with IQs of 45 to 39. This quite a severe intellectual disability. However, with support, they still master some basic self-care skills and some communication skills, but they will always need moderately high levels of supervision and support. Finally, is those with IQs less than 25, and these are classified as having profound intellectual disability. Though they can develop a little bit of basic self-care skills, they do need lots of supervision and help. At your own time, you can look at this diagram. I tried to summarize those things. So like the profound group require 24-hour care, and they really do need pervasive support in all of their daily activities, routines. The severe will need extensive support. Moderate need limited support, and the mild might just need intermittent times during transitions, times if the environment is all right. The mild mentally, intellectually disabled are usually those teachers call slow learners. They can learn up to grade or class 5. So if it's MCQ, and these days it's a lot of practical, but it will be much harder for them in high school and university. The moderate can again reach standard 2, but after that, academics become quite difficult. With severe, if we can talk and learn to communicate, number 5, where the cause is unknown, no specific cause can be identified. All right, I think I have talked about this a bit more. So, genetic causes. In genetic causes, there's abnormality of some genes, like the single gene mutation. And once this mutation happens, then it causes intellectual disability. The most common genetic cause for intellectual disability is Down syndrome. But then Down syndrome, there are 3 types. 2 of them cannot be inherited and they cause most. So generally, Down syndrome is not thought of as heritable. So in the hereditary genetic causes of intellectual disability, the most common cause is Fragile X syndrome. So Down syndrome are chromosomal disorders. They are one type of genetic disorder, usually cannot be inherited. And specifically with chromosomal disorders, there are changes either in the structure of the chromosome or in the number of the chromosome. And the most common chromosomal cause of intellectual disability is Down syndrome. So it's the most common cause of genetic, and it's also the most common cause of chromosomal, but it's not, it cannot be inherited. So that slot is taken by Fragile X. Okay, so, okay, I hope I'll put the environment later. Okay, let me first just go as my slides. So Down syndrome, it's very important in intellectual disability causes. It's trisomy 21 in the chromosome 21. Its prevalence is like 1% amongst those with intellectual disability, 1 in 1,000 live births. It's very easy to pick if you're familiar with this typical features of Down syndrome. Characteristically, the eyes are upslanting, the tongue protruding, the nose is flat, they are short with a short neck. Their characteristic hand features, the hand is short and broad, has a single flexion crisis, and the little finger might be slitted a bit in like that. They have low set ears and bulging tummy and umbilicus. They usually have that umbilical hernia. They may have diminished muscle tone. They do have strengths in visual processing. They are musical, they are pleasant, cheerful people with great social interaction. However, they are hard hit with weaknesses in language expression and pronunciation. Long ago, almost all with Down syndrome had mental retardation, but these days with early behavioral activities, the intellectual disabilities can be prevented, and more we are seeing more and more of these children for now who have Down syndrome and they do not have intellectual disability. So something is improving there. Fragile X syndrome, not as common as Down syndrome. It occurs 1 in 200 to 5,000 live births, while Down syndrome was one in 1,000. However, the Fragile X is the most common form of inherited, genetically acquired intellectual disability. The people with Fragile X syndrome also have typical characteristics. As you can see from the picture there, they have broad forehead, elongated face, high arched palate, large ears, and hypotonia. Muscles are weak. The thing about Fragile syndrome, X syndrome, the intellectual and adaptive functioning deficits increase with age. There's an increased risk for autism in the 20 to 60% do get autism spectrum disorder. There's also a higher risk for ADHD and social phobia. Their relative strength is in their verbal long-term memory, but they have weaknesses in short memory and in math. So if you're having problems with maths, check, you could be having FXS. I'm joking. So this Fragile X syndrome is caused by a mutation on the fragile mental retardation 1 gene, which is located on the X chromosome. It's the most common inherited cause and second most common genetic cause of both inherited and not inherited, second to Down syndrome. Boys are more affected than girls. The rates are 1 like into 4,000. The common signs of Fragile X syndrome is developmental delay, ADHD, ASD-like behaviors, poor eye contact. So there are many of these syndromes and time is running up, so I'll let you read up the rest and we focus more on the environmental causes, which might be more relevant for us because this is where we get most of the preventable causes of intellectual disability. So we go back to what had we said. The acquired can be congenital, metabolic conditions like hypothyroidism, and you know we can treat hypothyroidism. So if gotten before it's caused the intellectual disability, we can treat it. Then other congenital causes would be toxic lead poisoning, preventable exposures to substances, alcohol syndrome, and so on. Then we have the maternal infections, which we have always abbreviated as TORCHES for toxoplasmosis, rubella, cytomegalovirus, herpes, syphilis, and HIV. I don't know now whether the corona or corona is included, but standard, those are the TORCHES. So the acquired, the environmental factors can be congenital or developmental. In the developmental, again, we divide them into prenatal. These are toxemia, intrauterine malnutrition, umbilical cord prolapse. Then we have the perinatal, And then we have the postnatal. And in the postnatal is where a child could have been born with good intelligence, but they get cerebral malaria, meningitis, and so on. Then the environmental is the poverty, environment, few opportunities for learning, lack of stimulation, being in those orphanages where there's no stimulation, and so on. Yeah. So many of these acquired can be prevented. A common preventable intellectual disability is that caused by alcohol fetal syndrome. So congenital hypothyroidism, you look at the slides later. These are more of the genetics. Kwashako. Okay, so how do people with intellectual disability present? So we said it's a neurodevelopmental disorder, so the presentation will be different depending on the developmental stage, and the hallmark will be problems in intellectual functioning and in adaptive skills, which must have set in before the age of 18. Now, children with intellectual disability do develop, and they progress with normal milestones in a similar pattern like other people. However, their rate of development is slower. And then their full potential has a ceiling with an ultimate achievement, so that if it's mild, maximum is 70, no matter what happens. Okay, so the key thing will be abilities of these people being less than that of their age mates, and their glaring inability to adapt in their environment. So on a developmental level, they'll have impaired attention, impaired memory, impaired language skills, motor skills, learning, problem solving, and social and self-care abilities. They also have problems controlling emotions and their behavior. So as we said, these symptoms will vary according to the developmental level, but they also vary depending on the severity of the intellectual disability. So most of the people with intellectual disability will have mild, and most of them are of normal appearance without dysmorphic features. And the diagnosis might not be picked until school age, 4 to 5 years or even 9 years, when the academic pressure gets them. While with severe, most of them are due to underlying biological conditions, and many are more likely to have the dysmorphic features and a range of characteristic behavioral and psychiatric. So for mild and moderate intellectual disability in infancy may go Can you hear me? Somebody answer if you can hear.
We can now hear you, Doc.
Oh, all right. Our time is up. What do we do? Do we have time or we'll do it another time?
We don't have time. The other lecturer is already waiting.
All right, so we just say we'll arrange to finish because we still have the other one and this, although we just have just a few left. But okay, we have 5 minutes. Let's see what we can do in the 5 minutes, yeah? Okay, so the presentation will vary according to age. For mild school age is where you'll pick it. For severe, because of the biological and the physical stigmata, you'll be able to pick it from the word go. The other thing is that there's a lot of comorbidity with psychiatric and medical and physical disabilities as well. So the diagnosis is based on thorough developmental and family history, physical and mental examination, appropriate assessment of the cognitive abilities, the intellectual functioning, and adaptive skills, and then biopsychosocial investigations, which will be guided by findings of those earlier steps. Differential diagnosis would include borderline, other neurodevelopmental disorders like autism, language disorders, and specific learning disorder, depression, and so on. So basically, this management will do it in 6th year. So it just follows the normal routine of biopsychosocial investigations and then biopsychosocial interventions, and prognosis is, well, they can, if they have the specific and those are addressed good, otherwise still the others can be raised to their ceiling and they can live better quality life. So basically now the time we'll arrange for is for the specific learning disorders. Is that okay?
Yes, it's okay, Doc.
Yeah, so I'll send you this and then you tell me when we'll make up for that other one, including the others. Okay, bye.
Bye-bye.
Recording stopped.